Hello everybody and welcome to the Thursday edition of Video Clips, and I want to we'll start by talking about COPD. Lots of this these days, and I always tell people you can watch what's going on television. You can see what the disease rates are like in this country because every 15 minutes there's an ad on TV, and you've seen these with the elephant sitting on top of a person and they're explaining that's what having COPD is like. Well, according to a new study, I hope you're sitting down, a health-promoting diet can reduce the risk of developing chronic obstructive pulmonary disease. COPD refers to a group of progressive lung diseases that include emphysema, chronic bronchitis, and some forms of asthma. People who suffer with it have limited or blocked airflow, which results in difficulty breathing. Today, 15 million Americans have been diagnosed with COPD, and it's the third leading cause of death in the United States. So when you see those ads on television, you think about how much money they cost. You got 15 million people out there who are candidates to take those very expensive drugs. Smoking is a risk factor, but this is interesting. Over a third of COPD patients have never smoked, which means that there's something else going on as well. For this study, researchers tracked over 120,000 men and women, all of whom were health professionals. They reported that people eating a diet, now I hope you're sitting down again, how many times do I say this about things, that consisted of healthy carbohydrate foods like whole grains and vegetables and nuts and foods containing polyunsaturated fats were 1/3 less likely to develop COPD than people who ate more meats, sugars, and drank a lot of alcohol. Eating a healthier diet reduced the risk for both smokers and non-smokers and was related to risk after accounting for age, race, exercise habits, and weight. The researchers stated that the study didn't identify a cause and effect relationship between diet and COPD. But you might remember about a year or two ago, I reported on a study that showed that COPD patients who ate more fruit, vegetables, and fruit juice got better. They had improved lung function and reduced symptoms, and I included that citation in this article as well. And research has identified cause and effect relationships between diet and almost every other degenerative disease we can think of, so it's a high likelihood that it's a factor here. There are no negative side effects associated with eating a better diet, so there's no reason to not encourage everybody to do it, including COPD patients. Let's face it, they're not going to get any worse because they're eating fruits and vegetables, right? These findings support, this is what the researchers said, these findings support the importance of a healthy diet and multi-interventional programs to prevent COPD. All right, so we were just joking about this before we started filming this, that every week I get on the air on Tuesdays and Thursdays and say, don't take drugs, diet works, therapy works, something else works, don't take drugs. So in case you didn't get it, the last, I don't know how many of these broadcasts I've done, 560 times, don't take drugs, diet works, right? All right, so now we'll talk about menopause and drugs. Menopause, first of all, is a non-event for most women in most places in the world. It's an unhappy and uncomfortable experience for women in westernized countries, and it has spawned a huge industry for saliva testing and blood tests and pharmaceutical hormones and bioidentical hormones and all kinds of other drugs that are used to treat miserable symptoms. The tests are unreliable. The drugs have harmful side effects. There's not any data showing that bioidentical hormones are safer. And there are a lot of articles about all of this in the Health Priest Library. I won't try to regurgitate it here. What I do want to talk about is better options. A recent review of cognitive therapy and menopausal depression showed that there aren't many studies that have looked at the issue, but for women who don't want to take drugs, the few studies that have show that cognitive therapy is a viable alternative. Now, the researchers started with 5,126 studies and found only 2 that looked at cognitive therapy or mindfulness for women with major depression during menopause. Both studies showed that women improved after participating in these types of sessions. Now, just by way of giving you some definitions so you know what we're talking about here, cognitive therapy helps patients change the way they think in order to change their emotions. Cognitive behavioral therapy helps patients to modify their behavior in order to have them experience life in a different way. And mindfulness meditation helps people in many ways, including showing them how to tolerate and deal with stress more effectively. Probably most of us could do a little bit more of that. The first study included 169 women who had 16 sessions of individual therapy. All were much less depressed, and 25% not depressed at all after those sessions. Remember, we're talking about 16 sessions here, not a lifetime of therapy, which is what a lot of people end up signing up for when they sign on for traditional therapy. The second study included 44 participants who received 16 sessions divided into 2 hours per week. These women were also much less depressed after the series, so in all cases it worked. Now, another search of studies that included depression along with other menopausal symptoms identified 12 more, an analysis of which showed that women felt less depressed after therapy that included education, coping skills, and muscle relaxation to relieve symptoms. They also felt better. And who would be surprised about this, right? They felt better after mindfulness sessions that focused on stress reduction and relaxation along with breathing techniques. These therapies help then both hot flashes and mood. And hot flashes and mood are two of the biggest complaints associated with menopause. Now, limitations of the analysis included some of the studies were small, they didn't have control groups and that sort of thing, but lead researcher Cheryl Green said that with its low-risk nature, she's talking about cognitive therapy, it's something that I continue to practice with menopausal patients who cannot or choose not to take medications with success. So we can add cognitive therapy to the long list of non-pharmaceutical treatments that are effective for relieving menopausal symptoms such as diet and exercise. Now, not only do these types of things offer relief for the immediate problem, but they're also good for preventing other bad things from happening too. All right, that's all for today and for the week. Have a good one. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.